Hello, good evening, everybody. So, to be fair, if tonight's topic, chlamydia, is a sensitive one, then please tell your children to tune out for this particular talk because it may involve adult themes. So, Valentine's Day is right around the corner, and as a result, I've been noticing an uptick in recent requests for sexually transmitted disease testing, which is wonderful because the best thing you can do is to make sure that you are safe and that anybody that you love and that you're going to be close with is tested and is safe as well. So what's the big deal about chlamydia? Why is it so important to actually devote an entire little talk about it to tell you guys a little bit more information? Well, not only is it a sexually transmitted disease, but it is one of the most common ones that's out there in the country at the moment. Some of the ranges that I saw included anywhere between 1.5 million are actually reported to the CDC or Centers for Disease Control, but some people estimate that the actual number is somewhere between 2 and 4 million. So that's quite a few people that are having problems from this particular disease. So the big deal with it is because 90% of people who have it don't have any symptoms whatsoever. And this can be a big deal, especially for women, because if it gets up into the bladder, if it gets up into the uterus, it can actually cause quite a lot of problems. It can cause the tubes that connect the uterus to the ovaries. Those can scar down and make it very difficult for a woman to have babies later in life. Also, because of that scarring phenomenon that can happen, chlamydia can actually be one of the leading causes of ectopic pregnancy. Now, that's a big fancy word for saying the egg lands in the wrong part of the woman's anatomy, and then when it starts to develop, it can actually be deadly because a fertilized egg is supposed to land in the uterus, but if it gets caught up behind the scar tissue, it can't necessarily make it all the way down to the uterus before it gets fertilized. And so if it grows in the wrong spot, it can tap into a blood vessel and rupture and cause pain, and sometimes even the death of the lady who's so affected. So very, very important that we screen and test and treat for the chlamydia, especially, as I mentioned, because about 1 in 20 young women between ages 14 and 26 are suspected to have chlamydia, and they recommend for that reason that everybody be tested every single year up through age 24, 25. After that, of course, the people who are at high risk, multiple partners, new partners, people who come down with symptoms all of a sudden, should get tested. So let's see. So there are a little bit of disparities between the folks that are actually tested positive for it. If you look at the rates, you can actually see they break it down amongst different groups of populations. Another population where chlamydia is common is also among the men who have sex with other men. The screening rates of that are positive go anywhere between 3 to 10% of the population, and sometimes they check for this infection not only in the genital area but also in the mouth and the throat, and the rates are a little bit lower, about 0.5 to 2.3 in that particular population. We don't worry as much about that being in the throat area because very rarely does it actually cause significant symptoms in that location. And the same, of course, treatment goes regardless of which body part that it is affecting. So, as you might imagine, the main ways to avoid getting this particular infection are using latex condoms with every use, abstinence, obviously not having sexual contact at all, or having fewer sexual partners over the course of a lifetime. In other words, if you and your loved one are close and have both been tested, then the likelihood of either of you having problems over the course of lifetime is very, very low, especially if you're only with each other. So the main people that are at risk for chlamydia, again, anybody who's sexually active is at risk. The ones who are most at risk tend to be the teenager population. A few reasons for that. The people tend to not use condoms as commonly in that population. Sometimes people will start to engage in intercourse and then take the condom off during it. And that is one of those things that can be very troubling, of course, for the people that are exposed in that way. So please don't do that. So people might move from one relationship to the next frequently and basically don't realize they have symptoms for a few months or weeks after they get exposed, for example. And there is also something about the cervix that in the younger ladies that makes it a little bit more susceptible to actually getting the infection. So that brings me to another part of the thing with the chlamydia, is this little bug actually hides inside the cells. So one of the reasons why when we do the urine test, for example, we can test with a swab, we can test with a urine test. The swabs generally are just a little bit more accurate than the urine test, but for most purposes, the urine test is accurate enough to treat and diagnose. So as opposed to the usual urinalysis when people pee and then they catch it and then they pee a little bit more, that sort of thing, we actually want the very, very first few drops of urine when doing this particular test because of the fact that this hides inside the cells. And those cells are exactly what we want to have swept from the area and into the collection tube so that it can be diagnosed. And in addition to that, we usually recommend that the urine have been sitting in the bladder for at least an hour prior to collecting it because, again, we're looking to try to have those cells settle down and be part of the collection thing. So we don't exactly know how long does it take after exposure to chlamydia for someone to actually develop symptoms. Seems to be a few days to a few weeks, kind of maybe depends on how much of it's present in the partner. And again, as mentioned before, only about 10% of men and only somewhere between 5 and 30% of the ladies that are confirmed to have it actually say, oops, I had symptoms on it, or ever develop symptoms. So usually in the women it hides up in the cervix and it can go, as mentioned, climbing up into the uterus, climbing over to the fallopian tubes and further. The main thing is that it can cause a chronic pelvic inflammatory disease, and that is something that could cause women to have a great deal of pain, pain during sex, for example. And basically, whenever the cervix is bumped, then it can be very painful. In fact, we call that chandelier sign because when the woman is getting a pap smear or a test done, and you go anywhere near that area, they basically want to, as we say in medicine, climb up or jump up to the chandeliers because it's so exquisitely painful. And basically, the men who have symptoms sometimes have an inflammation along the ureter, and sometimes there's a watery or a mucousy kind of discharge and painful burning on urination as well. Occasionally, it will also go into the epididymis, which, if you're familiar with the anatomy, the testes kind of hang down and there's this little snaky kind of tube on the inside that goes up and back and towards, the penis, which is where obviously the secretions come out. And so that little snaky tube that's on the back of the scrotum, sometimes that can get inflamed and very sore and tender, and guys might feel like there's a lump there or something. And one of the more common causes of that is this infection of chlamydia on there. So it's fairly easy to treat. So if there's testicular pain on one side, tenderness and swelling, please go get it checked out. Chlamydia can also go into other body parts. The rectum is the more common location, and sometimes it also can get into the bladder as well, or into the prostate, and that can cause rectal pain, discharge, and bleeding. The prostate's one of those organs that when it gets inflamed, it can be pretty sore in that area. Alrighty, so complications. So, as mentioned before, we talked about the infertility, we talked about pelvic inflammatory disease. Now, a rare case is that sometimes it cannot just go up to the uterus or the ovaries, but very rarely this bug can actually go all the way up to the liver and cause something called Fitzhugh-Curtis syndrome, a fancy word for an inflammation of the liver capsule and the area that surrounds the liver. So that can be particularly troublesome if someone develops it. And then with women who are pregnant, it can actually lead to a number of complications with a pregnancy. For example, it can lead to the baby being born prematurely. So in other words, weeks before the baby's supposed to be out, and then has a much higher risk of having problems with learning, problems with basically surviving from there. A good percentage of the babies that are born to somebody who's not been treated can actually get infected themselves. Because as you imagine, if a baby is born through a canal that's infected, they're covered head to toe. The most vulnerable areas in the children are the eyes and also the lungs, because if they get that bacteria into their lungs, then they get pneumonia. And again, this can be potentially leading cause of blindness or a leading cause of pneumonia in the children who are exposed to it in this way. Around the world, chlamydia actually has historically been a very leading cause of blindness worldwide. And so this is one of those reasons why when children are born, very often they put little goopy stuff on the eyes. Not necessarily that chlamydia is thought to be the main cause of it, but it does help to reduce the risk of having it. In addition to that, this can also raise the risk of catching other diseases. So sexually transmitted diseases, not always, but very, very often, tend to go in groups or clusters. Because as you can imagine, if an area is inflamed and is sore and is troubled, so to say, or irritated by one bacteria, well, it's a heck of a lot easier for other viruses and bacteria and other things to just kind of go along for the ride. And of course, the same unsafe sexual habits that would cause one to get one particular STD also can predispose to getting the others. So for that reason, it's very important that if someone is suspected of having this particular infection, or if someone has symptoms, not only to get the treatment right away, even before the test fully comes back, because the treatment is really easy. 1 gram of azithromycin for most people, down at one batch, and that's it. Or if someone's allergic to azithromycin or erythromycin, then usually we'll give a few days worth of doxycycline, 7 days usually to be exact. But once it's treated, well, then it makes it a lot easier for people to not have any of those problems later on in life, especially the infertility, which is why the CDC recommends that all young ladies from 15 through 24 get tested every single year, regardless of whether or not they have symptoms. So talking about the children, when somebody's been tested positive or suspected to have it, then we recheck basically if they're pregnant 3 weeks and 3 months after the treatment's been given. And for women who are not pregnant, we recheck 3 months afterwards. And again, usually checking for not just the chlamydia gonorrhea, but for any of the other sexually transmitted diseases, HIV, syphilis, hepatitis. By the way, hepatitis B is preventable with the vaccine, and so forth, at least 3 to 6 months afterwards. So Anyway, this is kind of the main things, but I think we've covered pretty much everything. Talked about testing. Oh yes, partners. So it's vitally important that when somebody is tested positive for chlamydia and is looking to see, well, where can I improve the health outcome of the country, the population, to talk to somebody in public health, if you're in a clinic such as my own, because the public health departments will help with tracking and testing and contacting people, and can help with that uncomfortable, hey honey, guess what, I've got this disease and you should be tested too, kind of conversations. Now, this is one of those areas where, as a public health message, it's vitally important to put the health of the public, the health of the population, greater than the discomfort and the embarrassment and such of finding out that somebody has a sexually transmitted disease, because this is how these things spread. They're so silent, they're so asymptomatic. People have no idea that they have them, and they quietly spread through the population, and then people can have major problems and potentially deadly consequences of that. So there are actually resources on helping people to have that uncomfortable, usually conversation with significant others, the last person that one was intimate with. By the way, it is not possible to get this from a toilet seat. It's spread through intimate contact as well. But being able to have that conversation can be vitally important to your friends and the people that you've been close with. They recommend from the CDC contacting partners that you've been close to within the last 60 days in particular. And when can somebody have sex again after they're treated? So the number one key is, 1, complete the treatment, and 2, all current partners should complete the treatment also. Usually best if everybody does it about the same time. And then after everybody's treated, wait 7 days. Because about a quarter of the people who retest as being positive a few months after their initial infection, about a quarter of them will have been reinfected by a partner who wasn't completely treated. And so for that reason, many clinics are in the habit of basically, when somebody's got this, to go ahead and document that they actually witnessed the person taking the medication, so we can, check the box and say, yes, we know for sure this particular person has been treated for absolute sure. Because you would be surprised, but it's fairly common that somebody picks up the medication and goes home and has second thoughts and says, oh, why should I take this medication? And so forth. That is my talk tonight. I just wanted to put a little bit of a public service announcement out there, because the rates of many of these diseases has been climbing. There's many apps and many casual sex kind of websites and things where people are having hookups, and then they end up with something a little bit more than they were anticipating as a result. And so please take care of yourself, take care of those whom you are close to or loving, and just remember that the more that you're able to take care of yourself and stay safe, then it can be a very important part of living a long and healthy life. All right. So thank you for watching tonight, and more on a different topic next week. Take care. Bye-bye.